Hello and welcome to this class. In this class, I'll be teaching you about vaginal care. It's a free masterclass, but that doesn't mean that the values here are nothing. Okay, meet me. I'm Holawumi Esther. I'm a registered nurse. I worked in several departments of healthcare for close to a decade. Currently, I work with Lagos State. I'm super good at what I do, and I'll be your facilitator for this class. Before we continue, let me tell you a story. One hot afternoon, my friend Rachel called me in a state of distress. Her voice trembled as she explained her ongoing struggle with an unpleasant vaginal odor, which was always known to for her confidence and her vivacious personality. So it surprised me to hear her so vulnerable and in desperate need of help. I rushed to her apartment, very concerned for her because she was crying profusely over the phone. Rachel opened the door with tear-filled eyes, her emotional, somewhat evident. She led me to her living room where she poured her heart out. Overwhelmed by the embarrassment, she confided in me about the embarrassing moments she had faced due to the persistent odor. Rachel had tried countless remedies from over-the-counter products to homemade solutions, but nothing seemed to work. She felt defeated and isolated as the issue had started affecting her self-esteem and even strained her relationships. It was a heartbreaking realization that something so intimate was causing such distress. As I listened attentively, I could sense her desperation for a solution. Determined to help her find relief, I embarked on a journey to further educate myself about vaginal care. I spent hours researching reputable sources, consulting medical professionals, and getting abreast with the most recent vaginal care solutions. Armed with the newfound knowledge of what was happening to her, I approached Rachel with a plan. We sat down together and I explained some of the things I'll be teaching you in this masterclass to her. Rachel was relieved to finally have a clear path forward. With my guidance, she implemented these new practices into her daily routine. Over time, Rachel's confidence began to return, the odor continually diminished, and she no longer lived in fear of uncomfortable situations. She realized the importance of self-care and how vital it is to prioritize her own well-being. Rachel's journey not only transformed her physical health, but also nurtured her emotional and mental health. Would you, like Rachel, love to eradicate the unpleasant situations that you have with your vagina? Follow this training closely and be ready to take action at the end of it. If you know you're not ready to adjust as you learn these new practices, I think the class will not be beneficial to you. So kindly leave this video. But for those who would love to take charge of their health all round, let's get into the training. You'll be learning about the vagina, the science of a healthy vagina, pH and its relevance to vaginal health, vaginal infections and their causes, urinary tract infection, UTI, healthy vaginal tips, practices, and lots more. What is the vagina? Have you ever wondered what exactly is true? Should you ever wash your vagina with soap, water, or something else? The vagina is a muscular canal that connects the uterus, the womb, to the exterior. It is also known as the birth canal. It is a passageway that the penis goes into during sexual intercourse for the release of semen. It is a passageway through which the menstrual flow comes out from the uterus, which is the womb also, during menstrual flow. It is also where babies pass through when they are expelled from the womb. The vagina is very important. A lot of people think that the vagina is all of the female's genital externally. They often call the vulva the vagina, but the vulva is different from the vagina. But the vulva is different from the vagina. While the vagina is a passageway to the womb, the vulva is the outside portion of the female genitalia. That's the part that can be seen, and it has different components in it. The vulva consists of the mons pubis, the clitoris, the urethra opening, that is for passing of urine, the labia majora, and the labia minora. I hope there are people here that don't think that urine and menstrual flow come from the same place. Okay, so in this diagram, you can see the vaginal length. It is fully shown as it relates to the uterus. There you can see the vulva, the vagina, the cervix, the uterus, the ovaries, and the fallopian tubes. Next is the diagram of the vulva, the external part of the female genitalia, where you see the labia minora, the vagina opening, the urethra opening. You see it's different. So blood from menstruation and urine does not come from the same place. Then you see the clitoris and the mons pubis. Those are the things that makes up the vulva. Now, you must know that the vagina is a self-cleaning organ. That is, it cleans itself. You don't need to clean it. However, the vulva is not. A healthy vagina refers to a vagina that is functioning optimally, maintaining its natural balance, that is pH. We'll talk about it later, and supporting overall well-being. pH is the measure of the acidity or alkalinity of any solution. The fluids in the body all have several pHs that ensure that body cells function optimally. So the vagina also itself has its own normal pH. The skin has its pH, the blood has its pH, tears have their pH. Every part of the body have unique pH. Now, what is a sign of a healthy vagina? Here are some key indicators of a healthy vagina. Number one, a healthy vagina should have a normal discharge. It should produce clear or slightly white discharge that is odorless and has a mild neutral scent. This discharge is what helps keep the vagina clean by flushing out dead cells and bacteria. A healthy vagina should have a balanced pH level. The pH level of a healthy vagina ranges from 3.8 to 4.5, which creates an acidic environment that discourages the growth of harmful bacteria and yeast. Thirdly, there must be an absence of persistent itching or irritation. These signs can indicate an imbalance in pH or an infection. Another sign of an healthy vagina is the absence of unusual odor. While every vagina has its own unique scent, a healthy vagina has a mild, musky odor. This odor is not overpowering or unpleasant. Strong or foul odors may indicate an infection or other underlying issue. An healthy vagina does not have unexplained pain or swelling. You should not experience pain or discomfort. If you do, you should see a healthcare professional. Lastly, an healthy vagina has optimal elasticity and lubrication. The vagina has natural lubrication, which makes it comfortable for penetration during sexual activities and vaginal examinations. A healthy vagina should be able to engage in sexual activity without discomfort or pain. Now that we've learned about a healthy vagina, let's see what pH is. pH is a measure of acidity or alkalinity of a solution. It is measured on a scale of 0 to 14. The lower the pH, the more the acidic solution. The higher the pH, the more the alkaline or basic the solution. So if you say we have 2, 2 is acidic, while 10 is alkaline or basic. The body has an acid alkaline or acid base ratio. This is the balance between positive charged ions that form acid and negatively charged ions that form alkaline. The body is always striving to balance this pH. When there's an imbalance, many problems can occur health-wise, such as respiratory issues, metabolism disturbance, organ dysfunction, or bone issues. Under normal conditions, vagina has a pH of 3.8 to 4.4. That's acidic, right? It is colonized by a bacteria called lactobacilli, which may have a role in defense against infection. The lactobacilli help maintain vaginal acidity by producing lactic acid, thereby making the vagina inhospitable to many other microorganisms. Remember, normal vaginal pH is a crucial factor of good health in women. The more acidic the vagina is, the better it is able to prevent infection from the vagina, because this acid renders the harmful bacteria useless. If your vaginal pH is above normal, you probably experience some of the following signs, like itching, excessive discharge, and painful urination. These symptoms are similar to those of a yeast infection, although typically milder. You may have the symptoms, but most times if you have the symptoms, it is bacterial vaginosis, BV. Bacterial vaginosis can cause discomfort and pain of the vagina. It happens when neutral bacterial levels are out of the balance. When there's too much of bad bacteria, that's when BV occurs. In this case, don't use over-the-counter drugs, because most of these drugs out there are for vaginal yeast infection. Rather, see your doctor for diagnosis and treatment, because if you use an antibiotic that is not for that infection, you can develop an antibiotic resistance. Let's talk about what causes smell down there. A strong odor can be a sign of an infection, particularly if you're sexually active. I said earlier, the woman's vagina is naturally filled with bacteria, lactobacillus. These are the normal flora of the vagina. They are supposed to be there. They produce lactic acid that keeps the vagina acidic. Whenever there's an overgrowth of an invading bacteria, bacterial vaginosis occur. This is what causes the fishy odor. Although you need to know that not all vaginal odors are caused by an infection. There could be another underlying cause. Without further ado, let's go on to the tips for vaginal care. Now you know about the vagina, that it cleanses itself naturally in the form of normal vaginal discharge. Now, one thing you should know that would help you a lot. If you can wear white panties, please do so. But it's important to wear 100% cotton underwear. Ensure that you rinse your underclothes carefully after washing. You can even double rinse to avoid soap getting to your private part. Always wash your new underclothes, that is underwear, before wearing them. Don't wear it like that because you feel that it is new, so you shouldn't wash. Please wash it thoroughly. Use warm water to wash the vagina. Water alone is not enough. And please, if you're using soap, please, sister, stop it. This is due to the fact that chemical agents are used in the production of soap. So it is not advisable to use it near your lady parts. When your vagina's pH is compromised, it predisposes it to itching, thrush, and other kinds of infections down in that part. Let's talk about soaps. Soap, as we all know, is an important cleaning agent. But there are certain parts of the body that soap should not be used on. The face and the female intimate area. I want to do a video about the face later, but let's focus on the vulva today. Why shouldn't you use soap on the vulva? Soap throws off balance. It affects the vagina's pH because they are alkaline in nature, and when the acidic environment of the vagina comes in contact with alkaline soap, it neutralizes the environment and causes the protective microorganism of the vagina, which is the lactobacillus, to die. And once there is no gatekeeper to guard the vagina, you can imagine what will happen next. Several microorganisms begin to invade the vagina, and it leads to an infection. How to ensure that the pH level is balanced? During menstruation, it is important to change pads or tampons regularly. Avoid ash soaps and shower gels. Instead, use a product range that is specifically formulated for the sensitive area, like Feminine. This intimate care product was developed to ensure an optimized pH balance and to protect the microbiome, which is the good bacteria, lactobacillus. It also contains lactic acid, what we need to keep the vagina at its normal pH, which is acidic. It also has a prebiotic infusion and natural Swedish extract for lasting comfort. To cap it all up, this product is biodegradable, which means it is good for the environment. But let's go ahead to talk about urinary tract infections. I have a video already on urinary tract infections, but I'll just give you a run through again. So I'll leave the link to the video somewhere around this video or in the description box. If you want a more comprehensive video on UTI, you should check out that video. So a urinary tract infection, UTI, occurs when the bacteria enters the urinary tract through the urethra and begins to multiply in the bladder. Now, what is the urethra? It is connected to your bladder, and the bladder is that organ that stores your urine after it is produced from the kidneys. The urethra then passes the urine from the bladder to the exterior of the body. Women are more prone to UTI because their urethra is very small compared to that of men, which occupies the length of their penis. UTIs are very common, and almost every woman has had it at a point in her life, but you can put an end to it when you know the underlying cause. So what exactly causes UTI? Some things that causes UTI are poor cleaning practices. Your bathroom habits needs to be better. Please clean up after peeing, but always wipe your vagina from front to back after using the bathroom. When you do this, you prevent bacteria from moving from the anus into the urethra. Not peeing after sex. You might think this sounds silly, but make sure you pee right after sex. When you have sex, bacteria could be pushed into the bladder, where it can flare up into an infection. Once you pee, you flush out all the bacteria out of your system instead of letting it affect your bladder. Very importantly too, don't hold your pee for long hours, because doing so will give time to the bacteria to multiply. Another thing that can cause urinary tract infection is dehydration. Peeing is all about relieving bacteria from the bladder and urethra. If you do not drink enough water, or you're not going into the bathroom enough, you are inviting a whole lot of trouble, because there's no way any potentially harmful bacteria can be excreted from the body. The golden rule is to drink enough water so that your urine is light in color. Dark yellow urine means you need proper hydration. Do not force water or cleaning agents into your vagina. If you do, you can remove the healthy bacteria from your vagina and can push such infection into your uterus, making it worse. This is called douching. Luckily, vaginas are amazing organs. Not only do they help bring life into this world, they also do a great job of keeping themselves clean. This they do by balancing healthy bacteria and pH levels on their own. So, no douching is needed. Douching actually eliminates some of that healthy bacteria. This changes the pH of your vagina and makes you more susceptible to infections. Another tip is that you wear loose clothing and cotton underwear. This will increase airflow, especially when working out or sweating, to prevent moisture buildup, which can lead to bad odor down there. If you can, don't sleep with your panties on so your vagina can breathe. Another healthy vaginal tip is that you ensure to wipe from front to back after going to the bathroom. This prevents spreading of bacteria from the bottom to your vagina. You know, the anus is at the back while the vagina is in the front. So when you wipe from the back to front, you are bringing the bacteria from the anus to your vagina. So ensure that you do it from the front to the back. This will ensure that your vagina is free of bacteria that could cause odor and infection. Make sure you teach your daughters and your friends this. Please make sure to always wear clean underwear. Don't suffocate your vagina. Endeavor to practice safe sex. One of the best and easiest things to do for your vaginal health is to practice safer sex. Use protection. This could be a condom. Get tested regularly for sexually transmitted infections. You should get tested after exchanging genital fluids with your partner or partners. Mind the order of the sex acts that you perform. Going from butt play to vaginal play can increase the likelihood that you get an infection, such as those painful UTIs. If anal is your thing, make sure you do it after vaginal sex, not before. However, anal sex is wrong. Want to know more about it? Google it. Make sure you also check condom ingredients. There are tons of brands that make condom with spermicides. Now, spermicides aren't very healthy for the vagina as they can kill good bacteria in there too. Use other form of birth control if available to make a happier and healthier vagina. Now, there are several foods that can naturally promote vaginal health. Pineapple, which is a rich source of vitamin C, B, and fiber. Not only do these nutrients improve your gut health, they also help maintain your vagina's natural smell by keeping it healthy and preventing any infection. Yogurt have been proven to help balance and maintain a healthy pH by promoting good bacteria. Probiotic-rich food can prevent yeast infections and it contains calcium, which can alleviate premenstrual syndrome. Water. Drinking water keeps your vagina well lubricated. Vaginal dryness can have effects on your sex life because it can make sex more painful. And not drinking enough water can also lead to itchiness, burning, and general pain. Worse still, it could even lead to a yeast infection. Yeast and bacterial infections occur when there's a disruption of the normal pH balance caused by dehydrated skin inside the vagina. Cranberry juice. Cranberries are full of antioxidants and acidic compounds, which are powerful infection fighters that can help bacteria from adhering to the bladder wall. Research shows that cranberries can be especially beneficial in preventing UTIs in women with recurrent or recent UTI issues. Another food that can promote vaginal health is sweet potatoes. Sweet potatoes can strengthen your uterine walls, which is key to maintaining good vaginal health. Lastly, citrus fruits. Who doesn't like citrus? Fruits like lemons, limes, and oranges are packed full of vitamin C, which has been linked to fighting bacterial infections and healthy vaginal discharge. So while your vagina is self-cleansing, guess what? Your vulva is not. So if you don't clean your vulva properly, it will smell. Now here is my big question. Is water alone enough to wash the vulva? Water alone is not enough. If you use only water, the vulva will start having fishy and unpleasant odor and might even introduce infection into the vagina. I am sure many of us can relate. So many gynecologists advise using only water. Why? Not because ordinary water is the best. In fact, ordinary water is not enough, but because of the scarce availability of good intimate wash. This is why you must use only a good intimate wash for your vulva. Wash your vulva, not inside your vagina. Today I'm here to help you with the right product choice for your vagina and vulva care. I present to you the award-winning formula, the one out of all, Feminine Extra Comfort Intimate Cleansing Cream. Who is it for? Feminine Extra Comfort Intimate Wash is an intimate wash for maintaining pH level while strengthening your natural defense against irritation and infection. It contains natural lactic acid and chamomile flower extract to keep you fresh all day. It is for every woman and everyone who has a vulva and vagina. It is allergen, dermatologically, and gynecologically tested and approved. What are the pros of Feminine Extra Comfort Intimate Wash? It is soap-free, it has a natural pH balance, great lightening fragrance, contains chamomile flower, delivers gentle antibacterial and calming effects. that is for chamomile flower, and it helps to avoid itchiness, bad odor, and abnormal vaginal discharge. You have value for your money when you use Feminine Extra Comfort Intimate Wash. Feminine helps in preventing itchiness, bacterial infections, bad odor, abnormal vaginal discharge in the vaginal area. It has been tested and is proven. How to use: take a small amount of the solution in your hands and apply it on the external vaginal area during shower. Apply it gently and rinse with clean water. Dry the area with a clean towel because it is for external use only. It is for your vulva alone. One bottle can last for 7 to 9 months of use. Congratulations! You have successfully completed this masterclass on vaginal care. Would you take action? Click the link in the caption or comments.